series was founded a little over a year ago with the help of a generous bequest from the Quinn family. My co-director, Jim Keenan, and I have been asked over the coming years to bring to campus local, national, and international leaders to address timely issues in the intersecting fields of health, humanities, and ethics. In this, we see BC taking an important leadership role in the vital area of healthcare and ethics. We owe a debt of gratitude to the Park Street Corporation for their generous gift, which aligns the late Father Quinn's interests in social justice and ethics so well with the mission of Boston College. The Park Street series brings a group of speakers to campus each year around a central theme. This year, our focus is on an issue of great urgency, the health of the planet. Over the course of the year, we'll meet again to hear speakers address varied aspects of this topic, from food and sustainability to questions about how environmental disaster gets represented, to environmental ethics, to soil science, and to the human suffering and displacement associated with devastating storms. Tonight, we are especially fortunate to have a speaker with us who is so well equipped to link concerns about the environment to concerns about health and humanity overall, Dr. Phil Landrigan. So I'd like to ask everybody for a couple of logistical things, if you could just switch off cell phones so that we can all listen and focus. I should also add that there will be a reception following the talk, so you'll have an opportunity following the Q&A to be able to speak more informally with Dr. Landrigan. But firstly, I'd like to invite up to the podium Professor Tom Childs of the Provost's Office and BC's Biology Department, who will introduce tonight's distinguished speaker. Thank you very much.
Well, I want to thank everyone for coming out this evening. It's a real privilege for me to stand before you tonight and introduce a dear friend, not only my friend, but a friend of Boston College and a colleague, Dr. Phil Landrigan, class of '68. You know, time does not permit me to highlight all of his accomplishments, his service to our country, his honors, awards, his research, his scholarships. For to do so would take all of the evening, and you're not here to listen to me, per se, but you're here to listen to Dr. Landrigan. But I would be remiss if I failed to provide you just a snapshot, if you will, or a glimpse into really what I would say his calling in life. I think it's important that we walk you through a little bit of that. In a nutshell, the take-home message, if you're Instagramming or tweeting anyone, is that Phil is a card-carrying pediatrician. He is an epidemiologist, and he is one of the world's leading advocates for children's health. Specifically, his research, his advocacy, and a good chunk of his life has been focused on reducing the levels for childhood exposure to lead and pesticides. And I'm going to highlight a few things I think will show you what I'm talking about. After graduating BC in '63, Phil went on to Harvard Medical School and graduated in '67. And again, a brief summary, after that he did his internship at Cleveland Metropolitan Hospital and then a residency back here in Boston at Boston's Children's Hospital. And his residency was in pediatrics. He then ended up at the CDC in Atlanta. And you know, I was at lunch with Phil and one of our students yesterday afternoon, and Phil, you can correct me afterwards if I'm wrong, if I read this incorrectly, but up until that point, like many of our students and like many of us in this room, he was laser focused on pediatrics and being a physician treating children day in and day out. But he ended up at the CDC. And I think that was one of several really transforming events, because he began to think about how he could use his MD, his pediatrics training, his training at BC to really impact not hundreds or thousands, but millions and hundreds of millions of individuals. And just to highlight some of the things he did in a very short period of time at the CDC, he was director for their research and development in the Bureau for Smallpox Eradication. That landed him in Nigeria on the front lines in the early '70s of the World Health Organization's battle to eradicate smallpox on the globe, and smallpox has been eradicated on this planet, thanks to the efforts of many people, not to mention Dr. Landrigan here. He then went on, because he was really energized by epidemiology and public health, to get additional training at the master's level at the London School of Hygiene and Tropical Medicine. He completed with distinction a degree in occupational medicine at the University of London. Then he ended up to where he's been for quite some time at the Icahn School of Medicine at Mount Sinai. And he rapidly rose through the ranks. He's an endowed chair, he's professor, he's the dean of the School of Global Public Health, etc., etc. For those of you who like to do some bookkeeping, let me just give you some data. To date, he's published 191 original peer-reviewed articles. He's published 9 books, and I learned at dinner tonight, the 10th book is on its way out. He's published 501 review articles, commentary, trend articles, book chapters, commentaries, etc. He has received more awards than we possibly have time to discuss tonight, but I'm going to highlight a couple. He was elected by the National Academy of Science to the Institute of Medicine in 1987. He served on the President's Advisory Committee for Gulf War Veterans Illness from 95 to 96. And a couple of things that I want to highlight. He was on the American Academy of Pediatrics Committee on Environmental Hazards from 76 to 87, and he chaired that committee from 1983 to 1987. He then went on to serve as a senior advisor on children's health to the administration of the U.S. Environmental Protection Agency, where he helped establish the Office of Children's Health Protection, and that was around 1988 or so, I believe, within that room. So, I'm looking at this and I'm thinking about all of his contributions and his dedications to children and exposure and environmental hazards, to me it was obvious why Phil was doing this, but I reached out to one of his dear colleagues and friends last night, Richard Fuller, who I believe you're going to talk about tonight as you talk about our commission work and the work you've done with Richard. Richard is the founder of Pure Earth, and Richard said it's very simple. All you need to know about Phil is that he's driven by children. All he wants is a fair world for kids to grow up in. And I think that summarizes what has really directed and partly motivated him in his life. And the list goes on, but I'm going to highlight 3 areas that speak to me, and I believe also speak to Phil. In many ways, he is a person whose life is defined by action and leadership, a lot of things we talk about on this campus, including justice and charity, and a sense of calling. The very things we seek in our own students and we hope they aspire to achieve, Phil's life has been characterized by those. Now, if we back the clock up to 1970, as a young gunslinger at the CDC, they sent him out to El Paso, Texas. And he can tell you stories afterwards about his time in El Paso, Texas. But they sent him out there because children were being exposed, and they noted exposure to lead. And it turns out there was a lead smelting plant out there, and Phil and his team figured out that about 60% of the children living within 1 mile of the smelter had elevated lead levels. Further studies by his team eventually determined that lead exposures actually has a significant impact on young children's IQ. And I believe parallel studies with one of his colleagues, Herbert Needleman, and his work together with Phil's, this research played a key role in the U.S. government's mandate in phasing out lead components in gasoline. So when you pull up today or tomorrow to the gas pumps and everything's lead-free, you know who to thank, all right? And it also helped lead to a federal ban on lead paint in 1978 in this country. In 1988, at the request of Senator Patrick Leahy, he led a 5-year study at the National Academy of Sciences, which basically addressed the following question: were the exposure limits to pesticides that we deemed appropriate or sufficient or to humans, were they appropriate for children? And what his team found out, or what they discovered through evidence-based data, was that children are uniquely susceptible to adverse effects of pesticides. And that triggered a real paradigm shift in risk assessment and provided the blueprint for changing of federal laws, particularly the Food Quality Protection Act of 1996, which is one of the major governing pesticides use laws in America. If you fast forward, if that wasn't enough, immediately after the destruction of the World Trade Center on September 11th, Phil's team at Mount Sinai Medical Center strapped back on their epidemiology boots again. And I think they knew immediately, in talking to Phil, you glean this. They knew, for example, that in the North Tower they had put in 400 tons of asbestos. And when the towers collapsed, at least 400 tons of asbestos went into New York City, along with pulverized glass, parts of building materials, etc. And all of that, aside from the particulate matter, which was on the order of microns, 1 or 2 microns, it was alkaline in its pH. They immediately recognized, and then proved subsequently in publication after publication, that this had significant health effects on the respiratory system. Not only that, they further showed, as did others, that there were a variety of long-term mental health consequences that affected not only the survivors, but also the 70,000 or so brave individuals that were at ground zero. So tonight, he's going to tell you about work that he began in 2015, work along with Richard Fuller and Richard Horton. They formed the Global Alliance on Health and Pollution with work from the Lancet. I remember when Phil asked me to join the commission back, I believe in 2015, I asked myself, why in the world is Phil Landrigan doing this now? I mean, haven't you done enough? I mean, where are you getting the energy? And he explained to me, he didn't answer the question directly, but he said, Tom, let me explain to you the magnitude of this problem. And he's going to tell us that tonight, that health effects of pollution fall most heavily upon the world's most poor, most vulnerable populations, those that cannot take care of themselves or defend against this. And more than 90% of pollution-related deaths in the world occur in low-income and middle-income countries. Well, that was the key insight for me, and that's why he's doing this. And it also because it impacts children, but it impacts the poor. So to circle back around to what I said a little while ago, when I think about Phil, I think about his life and who he is. His life is, and he as a person is about justice and the sense of calling. But as we state on our webpage here at Boston College, he is also concerned about all of human families. So with that, I want to introduce my friend and friend of Boston College, Dr. Phil Landrigan.
That was embarrassing, thank you. So it's good to be here, it's good to be back at BC. And what I'm going to discuss with you tonight is work that we've been doing over the past 2 years, although, as Tom has already laid out, the roots of it go back way before that, to explore the impacts of pollution on human health and on the economy around the world. We had a commission of about 50 people. Tom, as he already said, was a member. Gautam Yadama, our new Dean of the School of Social Work here at Boston College, was a member of the commission, along with Carlos Salinas, the former president of Mexico, Princess Chulaborn, the Princess of Thailand, and a whole raft of distinguished scientists from countries around the world. Our team was very multidisciplinary. We had physicians, epidemiologists, economists, social scientists, politicians, people who could crunch the data, people who could analyze the data from multiple perspectives, and people who were skilled at translating data into real change in the real world, which was the point of the commission. So let's start off with the basics. What is pollution? Pollution is defined as this: any material introduced into the environment by human activity that endangers human health or damages ecosystems. Now here's a little quiz just to see if you're awake after dinner. Would anybody care to guess where that picture was taken? Start with thinking about what country it is. That's actually Cleveland, Ohio, in 1966. The location is about 4 blocks away from the hospital where I started my internship a year later, Cleveland Metropolitan General Hospital. That this particular area was right on the brink of sort of a canyon. Down in the bottom of the canyon were the steel mills that polluted the air and the notorious Cuyahoga River that periodically caught fire. On certain mornings, we had a long corridor in the hospital, and on certain mornings, it was not possible to see the length of that corridor because of the air pollution that was coming in from the outside. That was in the United States. That was 1967, 3 years before the passage of the Clean Air Act in 1970. So that's the definition of pollution. In the commission, we considered a whole range of types of pollution: indoor and outdoor air pollution, water pollution, both biological and chemical pollution of water, contamination of soil at industrial and mining sites, occupational exposures, and lead. And we could have included more, but we decided conservatively to stick to classes of pollution where there are good data on patterns of exposure around the world and good solid scientific information linking the exposure to a disease. And we'll get into that in just a couple of minutes. So first of all, a pictorial tour, just to give you a sense of some of the different types of pollution. This is household air pollution. Gautama Adama has written a brilliant book on this subject called Fuel, Fire, and the Fate of 3 Billion, which talks about the people in the poor countries of the world, focusing on India, who have to spend 6, 8, 10 hours a day chopping brush, picking up cow dung, anything that will burn, and putting it into these little household stoves with no ventilation. And the consequence is that the people who live there inhale this stuff. They get lung disease, heart disease, lesions in the eyes. Their babies are born small and sickly. This is also the U.S. This is Texas, again before the passage of the Clean Air Act, although maybe it'll be going back that way before too long. Ambient air pollution. Here's New Delhi, that a year ago had the worst pollution event since the 1952 London fog that killed at least 4,000 people. Water pollution, globalization of the chemical industry. This is a picture of the remains of the infamous chemical plant in Bhopal, India, that blew up in 1984, spilling a chemical called methyl isocyanate out across the city of Bhopal in the middle of the night. The chemical is heavier than air, so it rolled across the landscape. It was a heavy gas that rolled across the landscape and killed people in their beds, killed hundreds and left thousands more permanently damaged. Pesticides the use is growing globally. We're spraying 1 billion pounds a year in this country, and it's going up every single year as we grow more and more genetically modified crops that require enormous amounts of herbicides. I think we've got Michael Pollan coming later in the year in this series. He'll have much to say about that. And as much as we're using in the States, it's less than 20% of the global application as industrial agriculture spreads around the world. Soil pollution, this is New Jersey before 2001, obviously, you can see the Twin Towers. Asbestos. Asbestos is, in my mind, should be, the fact that the stuff is still being sold in 2017 could be classified as a crime against humanity. It's a known human carcinogen. It causes lung cancer, mesothelioma, laryngeal cancer, ovarian cancer, and is linked, although not definitively, to GI cancer and a couple of others. And yet 2 million tons of this malignant material are still mined every year and shipped around the world. Most of it goes into the poorest countries, into India, into Thailand, into the poor countries of sub-Saharan Africa and Latin America, where it's mostly used to make construction. And the use is actually going up in these countries. We've pretty much got rid of asbestos in the United States many years ago. But in these poor countries, it's still going up. And the toll of devastation and death that this asbestos is going to leave is massive. I've calculated 125,000 cases of mesothelioma around the world each year going forward. This is e-waste at one of the many locations around the world where old computers and telephones are collected. This one is Ghana, there's others in India, others in South China. This is mercury poisoning. What's going on here is that around the world are people called artisanal gold miners. These are poor people, usually in remote places, who pan for gold in streams, and at the end of the day will bring home a few rocks, pieces of quartz typically, that will have little flecks of gold in it. In order to get the gold out of the rock, they crush the rock up, pound it into sand, and pour in mercury. And they do that because mercury has the magical property that it binds to the gold, forms what's called an amalgam. Then they take this amalgam containing the gold, they bring it home, they put it in a dish, like this dish here, and they hit it with a blowtorch, and they boil off the mercury. The mercury vaporizes at relatively low temperature, the gold stays behind, and then they get the gold, they can bring it to the market. But the problem is that the mercury vapor is intensely toxic. It's toxic to the brain, it's toxic to the kidneys in particular. And as you can see in this circumstance, the entire family is exposed to this stuff. There are hundreds of thousands of people around the world doing this. China is a big part of it, also Africa, some in South America. Every city in the world has a battery recycling plant that looks something like this, where people break up batteries with hammers and then throw the metallic part of it into a furnace to recover the lead so that it gets recycled in the markets. But as you can see, the occupational hazard is great, and frequently these operations take place in backyards with kids and pregnant women within 10 meters of the battery recycling area. So that's just a quick pictorial tour of pollution around the world. It's a big problem, it's a geographically distributed problem. It's a problem that in the last 3 to 5 years has come increasingly into the news. We've heard about the pollution episode in New Delhi, we've heard about the Olympics in Beijing, and how much better the athletes did because the pollution was cleaned up for the 2-week period during the Olympic Games. But here's the kicker. Despite the magnitude of this problem, despite all the millions of people that it affects, it is grossly neglected in the international development agenda and almost not mentioned in the global health agenda. It gets, I'll show you a graph in a few minutes, but it gets about 2% of the international development agenda goes to controlling pollution in developing countries. And it was against that background that Richard Fuller and I and 50 of our closest friends decided to form the Global Commission on Pollution and Health, which we launched in July of 2015, with 3 aims. The first was to raise global awareness of this problem, to end neglect of pollution-related disease, and to mobilize the financial resources and the political will that are needed to take on this problem. Presaging one of my conclusions, we think pollution is a highly solvable problem. It's much more tractable than climate change. It doesn't have the built-in momentum of ecosystems that are going to bedevil efforts to control climate change. This is a very directly human-made problem and can be controlled by changing human behavior, but I'll come back to the details on that. So just for the statisticians in the group, we got our data from 3 sources. The primary source was the first one, the Institute for Health Metrics and Evaluation at the University of Washington, in Seattle, who do just a marvelous job with the help of megabucks from Bill Gates in calculating the global burden of disease and premature death. We also pulled data from the World Health Organization and from Richard Fuller's group, who has data on soil contamination around the world that's available from no other source. And here's our main findings. If you want to leave after this slide, you may. First of all, we found that pollution in all its various forms kills approximately 9 million people per year. That's 16% of all deaths globally, so 1 in 6. And in each year, pollution kills 3 times more persons than AIDS, malaria, and tuberculosis put together. Just a shocking statistics, 3 times more than the big 3 infectious diseases put together. In addition to those deaths, pollution is responsible for an enormous burden of disease and disability. We used a calculation called the DALI, the Disability Associated Life Year. I won't bore you with the methodologic details of that, but the bottom line calculation is that pollution is responsible for 254 million years of life lost every year. It's the foreshortening of life and the reduction in economic productivity that is the consequence of disease and death is just extraordinary. And here's the breakdown of where that 9 million comes from. If you're quick with arithmetic, you'll see that this does not add up to 9 million, and the reason for that is that there's a certain amount of overlap between the categories. 6.5 million from air, both ambient and household, 1.8 from water, and so on down the list. So let's put deaths from pollution into perspective with deaths from other causes. And this is a graph we put together there. On the left is Ebola, which, as we all know, was a terrible scourge in the 3 countries of West Africa when it hit a couple of years ago. But its impact on global mortality was negligible, despite the enormous impact it had in Sierra Leone and Liberia and Guinea. Here is war and murder. Here's road accidents, malnutrition, drugs and alcohol, AIDS, malaria, TB, salt, tobacco, and finally, pollution. Now, of course, this is a picture taken at only one point in time, 2015. If that picture had been, if I put up a comparable slide from 2005, you would have seen many, many more deaths from AIDS. The reduction in deaths from AIDS over this period of time, along with reductions in TB and malaria, is a human trial. Somebody like Jim Keenan knows a lot more about the details of that reduction in AIDS mortality than I do, but it's the mobilization of resources, the political will, the leadership, and just the simple human decency that led to the reduction in deaths from AIDS, plus the brilliant science that created the high-efficiency antiretroviral drugs, is an amazing tale. But in any event, here in 2015, the most recent data that we can get our hands on, pollution is number 1, exceeded only by hypertension and dietary factors. Within pollution, we divided the various types of pollution into 2 broad categories. So the line that starts high on the left and goes down to the right is what we call traditional pollution, which means household air pollution and biological contamination of drinking water. Those are going down, and that reflects superb work that has been done by the World Health Organization, a vast array of not-for-profit organizations, the Clean Cook Stove Alliance going after indoor air pollution. And in the numbers of deaths from those 2 causes continue to go down year to year to year, which is great. But the bad news is that the modern types of pollution, the line that starts lower and goes higher, so that's ambient air pollution in cities, chemical pollution, soil pollution, occupational pollutants, all of those are going up, and the number of people that they're killing each year is going up as well. So here are the drivers. Urbanization is a huge driver. Many of you will know that in 2008, for the first time in all of human history, more than half of the world's population resided in cities. We've come a long way from being hunter-gatherers. Australia is getting up to something like 85% urban. Latin America is predicted to be 90% urban within another 10 to 15 years because of agrarian policies that drive people off the land and into the cities. This country is a bit more balanced. Europe is a bit more balanced. But the world is becoming a world of cities. And if any of you have been to a third world megacity, to Mexico City, to Nairobi, to any of the big cities in India, to Beijing, you know that the population in these places is just exploding. And not only in those big headline cities, but also in the 2nd and 3rd tier cities below that. In all of these cities, the populations are just exploding. And it's interesting when a lot of you will have traveled, you've been to nice places overseas, you go to cities, and the tour books will always show you lovely pictures of the downtown, the beautiful skyscrapers, the ancient fountains, depending on where in the world you are. But where the action is in public health is the ring around the city. That's where the poor people come, the people that have left the land, either because they're seeking gold or because they've been driven off their farms, or some other reason, because they've read books that told them about the allure of the city. They come, they pile into these shanty towns around the cities, and they suffer what has come to be known as the double burden of disease. They still have the parasites that they bring with them from the country, and on top of that, they're exposed to the chemicals, the air pollution, and everything else that goes, not to speak of the violence and stress that goes with living in a peri-urban slum. They're truly dreadful places around the world. Motor vehicles, traffic-related air pollution is a driver. Industrialization, 70% of the heavy chemical manufacture now is done in low and middle income countries. It's increasing at a rate of 3.4% per year, which means production is doubling every 25 years, 25 or 30 years. And most of the chemical manufacture today is in countries where there's no OSHA, there's no EPA, there's no legal structure, there's no enforcement, and the consequence is just the chemicals are being used willy-nilly, people are being exposed, and people are dying. And that's just more of the same. So people have done projections. This particular scientist, Dr. looked at Southeast Asia, looked at air pollution in that part of the world, and projects that under what he calls a business as usual scenario, which is to say that current regulations such as they are enforced, but no new interventions are brought to bear, that the number of deaths due to particulate air pollution is going to increase by 50% over the next 3.5 decades till 2050. Hopefully we'll be smarter than that. Something that's important from the perspective of epidemiology is that 70% of the deaths caused by pollution are non-communicable diseases. Didn't always used to be that way. 60 years ago, it would have been the other way around, that most of the deaths due to pollution would have been caused by dysentery in kids who were exposed to contaminated water and pneumonia in people who were exposed to bad air. But we've cleaned up the water, we've reduced the household air pollution. On top of that, we've got new vaccines like pneumovax, rotavirus vaccine, new treatment protocols for kids with dysentery like oral rehydration therapy. And this combination of clinical interventions as well as public health interventions has driven down the rates of death from those traditional forms of pollution. And so today, pollution is, especially air pollution, is causing mainly non-communicable diseases. And here are some of the specifics diving into that. Almost a third of all deaths from cardiac disease, 11% of deaths from chronic obstructive lung disease, 16% of deaths from lung cancer. And yet, curiously, despite this huge impact of pollution on non-communicable diseases, the World Health Organization barely mentions pollution in their global strategy on prevention and control of NCDs. They talk about smoking, they talk about diet, they talk about getting lots of exercise, eating fruits and vegetables, but they don't talk about pollution. I mentioned chemical pollution. Chemical production has been going up steadily since the end of World War II. Here's an example of one particular herbicide, glyphosate, known as Roundup, which is widely used in the United States on GMO crops. And you can see these data that span the 20-year interval from 1992 to 2012 show that glyphosate use has increased something like 250 times in the United States, 2,500% in that 2-decade period. Here's some stats on the chemicals. There are now at least 80,000 chemicals in commerce. That's a US EPA number. The Organization for Economic Cooperation and Development in Europe says there are 140,000. Anyway, there's a lot of chemicals out there, most of which did not exist in 1950. These are synthetic chemicals that are all man-made. Here's the real problem. Many of the chemicals, of course, have been very helpful. They include new drugs, new cancer treatments, new antibiotics, new vaccines, construction materials, plastics that have helped our lives to be better. But despite these benefits that the chemical revolution has brought us, we've been very, very poor stewards of that chemical development. And the proof positive of that is the fact that for the great majority, or at least for the majority of these chemicals, there's not even minimal information available on toxicity. And then when somebody like myself as a pediatrician asks the question, well, what fraction of these chemicals have been tested to ascertain whether they have negative effects on early childhood development, it turns out that only about 1 in 5 has been tested. And if you think back over the history of the chemical revolution of the last 75 years, it's been punctuated by a series of disasters, starting with thalidomide, diethylstilbestrol, the chlorofluorocarbons that destroyed the ozone, methyl isocyanate in Voltol, asbestos, DDT, PCBs. Each of these chemicals was hailed as the greatest thing since sliced bread when it first came on the market. They were brought on the market with enormous enthusiasm, widely disseminated. Smart chemists found commercial uses for them, put them into products, but of course they didn't stay on the products, they got out of the products, into the environment and into people. And time and again have been responsible for disasters that we could have prevented, or at least most of them, had we exercised foresight, which we didn't. And by the way, these chemicals are not just out in remote places like Nebraska. They're in all of us. The CDC does a rolling survey every year now across the United States, taking blood and urine samples from a fraction of all Americans, and they pick up somewhere in the neighborhood of 200 synthetic chemicals in all of us. Relatively low levels, sure, but the chemicals are there. And since most of them have never been tested for toxicity, we really do not know what negative impacts they might be having on people's health. Here are 5 categories of newer chemicals that have come on the market, or at least become prominent in the last 20 years. And my great fear is that some of these newer chemicals that are just as untested as their ancestors are going to repeat history all over again by being found to be responsible for global pandemics of disease and death. To provide an intellectual framework to understand this chemical universe, this universe of chemical pollutants and its impacts on human health, we concocted this thing called the Plutome. Those of you who are in biology will know that ohms are all the rage these days, starting with the genome and the exposome and the microbiome. Well, the Plutome is a homemade term, and we envision it as a wholly contained, nested subset, if you will, of the exposome. The exposome is the whole universe of everything we're exposed to, good, bad, and different. The Plutome is the subset of the exposome consisting of bad things. And we further divided the Plutome into 3 broad categories. The first one are the types of pollution where we have characterized the pollution and its health effects pretty clearly, and we've been able, through the Global Burden of Disease study, to come up with a robust estimate as to the number of deaths that result each year. So the classic example is air pollution, where we really have established quite good links between air pollution and a series of diseases. Then in the next category, we have pollutants that are sort of well known, or pollution-disease connections that are emerging but not yet quantified. Let me give you a couple of examples. There's emerging information, for example, that air pollution is related not only to heart disease, stroke, and lung disease, but also to dementia, to the early onset of dementia. It's not a robust literature yet, but there are a half-dozen articles out there very well done establishing the connection. If that is borne out, if more science confirms that, and if strong dose-response relationships are established, linking a certain level of pollution with a certain frequency of disease in populations, that's going to be massive. That's going to add millions more, I don't know how many millions more, but millions more deaths each year to the 9 million that we currently know about. There are also emerging studies suggesting that air pollution is linked to diabetes, to autism, and to kidney disease. Kidney disease is actually, it's newer, but it's pretty robust, and it actually comes out of WashU in St. Louis, a guy named Benjamin Bowe. It's in the Lancet Global Health this week. So we'll see where those lead. Then we have chemicals of known toxicity around the world, like lead and mercury. We know they're toxic, we pretty well know what they do to people, but we don't yet have accurate counts on how many people around the world are sickened and killed by those chemicals. Well, as our ability to measure and count things advances over the next couple of decades, we're going to know a lot more about the number of people with lead poisoning and mercury poisoning. There's going to be a big push on mercury poisoning now that the United Nations has just ratified what's called the Minamata Convention, which is a global treaty to do something about the global problem of mercury. So right now, we have 0 deaths from that second zone counted in the global burden of disease, but we know that they're there. And then finally, down to the third zone, we have the newer chemical pollutants, the organophosphate pesticides, the neonicotinoids, the chemical herbicides, the plastics, the microplastics. And again, we don't have any clue as to how many deaths might result each year from that. So in this report, we put out the number 9 million deaths per year, which is a big number. But it's in fact a conservative number. It's an undercount, absolutely, of the true reality. Cities are hard hit by pollution, especially the rapidly growing cities that I was just describing in low and middle income countries. There's a lot going on in cities. More than half the world's population, 75% of greenhouse gases, 85% of global economic activity is in cities. So it's no wonder that a lot of waste is generated. The death rates are highest in the world's poorest places, as you can see there from the fairly intuitive color code. And 92% of all pollution deaths are in low and middle income countries, which of course is environmental injustice on a global scale. Here's the same data portrayed graphically, which enables us to get a little better handle on where the action is. So on the left side, the very poorest countries don't have anywhere near the number of deaths per capita as the rapidly industrializing lower middle income countries. So the really poor places, think the Central African Republic, think Niger, they're still losing a lot of people to water pollution and indoor air pollution. But then when you get to the lower middle countries, this would be Thailand, Uruguay, emerging markets with lots of new industry, largely unregulated, burgeoning air pollution. China and India are in the middle income category. That's where the real high death rates are. And then finally, when you get up to the high income countries, which is the US, Western Europe, Japan, Australia, the death rates fall again because we've learned how to control pollution and we put political will and money into controlling it, at least up until January 21st, 2017. So kids are exquisitely sensitive to pollution. They breathe more air than adults, about 4 times more air per day per pound of body weight, which means that they inhale much more pollutants, they drink more water, they put their hands in their mouths, they can't break down their chemicals because their enzyme systems are not well developed. They're biologically vulnerable. We now know from bitter experience, from DES, from methylmercury, from lead, that tiny doses of exposure at the wrong point in early development can have devastating effects on the health of a child. Doses that would bounce off an adult can cause permanent damage to kids. And they have a long life. So to accept the notion that many diseases of adult life are actually the consequence of physiological and biochemical changes, genetic changes that take place in early life, the kid has 6, 7, 8, 9 decades ahead of them. That's a long time for those biochemical changes to play out and ultimately become manifest as some form of chronic disease, cancer, heart disease, lung disease. We did, a big focus of the study was on economics. So you might ask, why would a pediatrician care about economics? Well, I don't. But, but I found that it's very important when you're doing these kind of studies to bring in the economic argument, because ministers of finance in developing countries who may not be swayed by the health data because they want to see their countries develop and get rich and become just like the United States of America, will be persuaded by financial arguments. And by the way, it's not just ministers in developing countries, it's also the state legislature in New York with whom I've spent too much time. The financial arguments are powerful because they hit the pocketbook and they become a powerful lever for persuading governments to do the right thing that they might not otherwise do. So we very deliberately brought a team of economists onto the commission. It was actually the lead economist in that group was Nobel laureate Kenneth Arrow, who sadly passed away in the middle of the work. And the work was carried on by Maureen Cropper, who was a member of the National Academy of Sciences, backed up by Alan Krupnick and Alex Breaker. So we had a good team. And we found that in low and middle income countries, pollution in all its forms is responsible for undercutting GDP by about 2%, and that caused by loss of productivity. Loss of productivity is the reduction in economic output that takes place when somebody is killed by pollution and drops out of the workforce, or is made sick by pollution and either drops out of the workforce or can only work at half speed. And a 2% loss of GDP holds back development. So the very minister who is involved in his country, or her country, in trying to boost development by bringing in industry, is actually shooting themselves in the foot by allowing that industry to be polluting industry, because it erodes the very gains that they're seeking to achieve. On top of the loss in productivity, pollution causes disease, and disease costs money. If you don't believe me, come to the hospital. I'll take you to the building department. And we have the best data in the world, it turned out, came from Sri Lanka. And in Sri Lanka, rapidly industrializing lower middle income country, healthcare costs for pollution-related disease suck 7% out of the economy of the country every year. So you put that 7% and the 2% are additive, or almost additive. If you take 9% out of the GDP of a rapidly developing country, you've basically taken the wind out of the sails of development. And we think that this is a very powerful argument that we'll be presenting in the coming months in one-on-one meetings with ministers of finance in a number of countries. The economists also did what's called a willingness to pay analysis and computed, using this, in my mind, somewhat magical way of computing disease, that pollution costs $4.6 trillion per year, which is 6% of global economic output. We didn't even get into the costs of environmental degradation. We know that they're substantial. Damage to ecosystems, damage to natural resources, damage to fisheries. It's all important, but it was simply beyond the purview of our commission, but those costs are additive to everything above. We were at great pains to point out that there are multiple connections between pollution and climate change. They both arise, especially air pollution and climate change, both arise from the same source, which is combustion. Combustion of dung and sticks in the third world, of coal and gas and oil in countries like ours, accounts for 85% of airborne particulate pollution and is the major producer of greenhouse gases. And the same industries that produce carbon dioxide are also the big polluters, the ones I've listed here. And on the ground, there are malignant interactions between climate change and pollution because, for example, when the city gets hotter, there is more ozone formed under the direct influence of sunlight, and the interaction of heat and pollution on respiratory health and cardiac health is not good for people, and the health impacts are magnified. The good news is that both could be mitigated by many of the same strategies, specifically by transition towards what's been called a circular, sustainable economy, where waste is reduced, efficiency is maximized, and the world is greener. A brilliant environmental scientist in Stockholm, Johan Rockström, has come up with this concept of planetary boundaries, the notion that we live in sort of a Goldilocks environment here on the surface of planet Earth. Things aren't too hot, things aren't too cold, things are just right, the way it was for Goldilocks and the porridge. And it's not just the temperature, but it's also the accessibility of ecosystem diversity, having the right amount of ozone up in the stratosphere protecting us from solar ultraviolet. And he and his colleagues have tried to plot how far along the road towards global destruction we are in each of these 9 realms of the planetary support system that he's shown here. And you can see that in terms of, down at the 7 o'clock point on this graph, in terms of phosphorus and nitrogen pollution, we basically exceeded the carrying capacity of planet Earth. In the case of land use, which is about 9 o'clock on the graph, we're getting there. Climate change, we're getting there, and we're not going in the right direction. Perhaps the worst hit is up there at about 11 o'clock. You see that in terms of genetic diversity, we're in a spiral of extinction of species, and it's going to be millennia, many millennia before that is undone. It's very important to put this whole pollution issue into a moral context. And this is a figure I used a few minutes ago, but let me bring it out again because it's so stark, that 92% of the deaths caused by pollution occur in poor countries. In any country, including this one, pollution disproportionately affects the marginalized. It's women, kids, the elderly, the minorities, and all of this is in powerful contrast, terrible contrast to Pope Francis' words in Sea. The Sustainable Development Goals are 17 goals that the United Nations has established to guide human development between the year 2015 and 2030. They are the successor yardsticks to the Millennium Development Goals that guided development between 2000 and 2015. And it turns out that controlling pollution will accelerate attainment of a whole slew of these sustainable development goals. Most directly, it's going to help out with the attainment of 3.9, which specifically calls upon countries to reduce deaths from pollution, but it also will benefit all of the ones that are listed here: ending poverty, providing clean water, sustainable cities, and slowing climate change. Now here's this is the second really important slide in this presentation. The first one was the one I showed you way back, showing how many deaths pollution causes each year in relation to other causes of disease and death. This is the second big one. The fact that pollution is not an intractable problem. It can be controlled. It's the product of what Pope Francis has called he's called it the throwaway culture. We call it the take, make, use economic paradigm, the one pass through and throw the beer can out the car window sort of way of life. And we somehow, we humans have to get our heads around the notion that that is simply not a sustainable culture. The earth will persist, the cockroaches will certainly be here in a couple of thousand years, but we won't, or at least not in the form of an organized society, if we continue to live this way. There may still be humans on the earth, but we'll be back hunting and gathering, and probably doing so in a radioactive wasteland. And basically what's needed is to transition towards a more sustainable world, and lots of countries have done this. We've done it. I mean, we're not perfect, and right now we're regressing, but compare the environment in the United States today to in the late 1960s. Our rivers no longer catch fire. We can see down the length of hospital corridors. Waste dumps are no longer burning out of control. We put money, we put political capital, we put human capital into controlling pollution. We've developed strategies which are based in law and policy, and then are enacted by a combination of political leadership, civil society, enforcement, taking away subsidies for polluting industries, and penalizing people that refuse to behave. And these strategies are now well honed, they've been well described, a lot of scholarship has been devoted to elucidating them, and they are ready to be taken to scale and exported globally. What are the barriers? The barriers are, first of all, inertia, because people have always done it this way. Secondly, an economic belief that has crept into the textbooks called the environmental Kuznets curve, which postulates the countries have to go through a phase of pollution and death and economic inequality before they can get to the sunlit upland meadows. Simply not true. It's an old notion. It was formulated decades ago when clean fuels and modern pollution controls were not yet available. The descent into the valley of pollution can be avoided by putting clean energy into place early in development, by switching industries, by not subsidizing coal-burning power plants. China has actually become a world leader. China is on target to have something like 20% of its energy produced by renewables by 2030. They're really getting out there with a combination of wind and solar power. That's still not enough because the population is still growing, but it's a big step in the right direction. Here's the argument that we make again to the finance ministers that pollution control can yield big cost savings. US EPA, before this was taken down off the website, had done very careful calculations showing that since 1970, every dollar invested in the control of air pollution has returned $30 to the US economy. Most of that in the form of averted disease and therefore averted cost of disease. And in the case of the thing that Tom Childs referred to in that eloquent introduction, the removal of lead from gasoline has added billions of dollars to the economy because when we took lead out of gasoline starting in 1976, kids got smarter. Smarter kids are more creative. They're more economically productive, and they therefore give more back to society and to the economy. This is a great graph that we borrowed with permission from the New England Journal of Medicine. It came out just a few months ago in that journal. And this is looking at pollution control versus GDP in this country. So let me walk you through it. The pale blue line below the zero mark, the pale blue line that goes down from 1970 to the present, that's a cumulative index of the 6 major external ambient air pollutants. And you can see from just counting the numbers there that air pollution has come down in this country by something like 70%. At the same time, the topmost line, the pale green line, you can see that GDP has increased by just about 250% during that same time period. So anybody who tells you that pollution control stifles economic growth, kills the economy, is bad for business, is wrong. They're just wrong. The facts do not support them. It's just not there. It's a political argument that you hear all the time, especially from people on one side of the political aisle, but it is simply not borne out at all by the data. This goes back to the theme that I mentioned way at the beginning of the talk, that while pollution kills 9 million people per year, 3 times more than AIDS, malaria, and TB, the right-hand side of the graph shows you the relative allocation of international development resources to these 2 buckets. Now, I'm certainly not saying even for a moment that there should be any reduction in the resources that go to the infectious diseases. They should be increased. But it's scandalous that pollution control in low and middle income countries gets so little attention. We give a lot of thought to why that might be. Part of it is inertia. Part of it is misguided economics beliefs, the environmental Kuznets curve. Another part of the problem, I think, is the way ministries of health and environment are set up in countries around the world. So we have, in one building, on one street, we have the Ministry of Health, which is thinking about maternal and child health, immunizations, cancer control. And down the block is EPA, which is staffed by engineers and lawyers, and they're thinking about environmental regulations. But seldom are they thinking about the intersection between the environment and human health. You go to the newspapers, the medical reporter is writing about the newest cure for cancer or the latest way to stent your coronary arteries, and the environment reporter is talking about polar bears. And again, there's little connections, like they're on different planets. And even within the environment ministry, you have people that worry about water, people that worry about air, people that worry about solid waste. They have their own rules and regulations. They don't talk to each other. The net effect of all this fragmentation is that until now, the full magnitude of pollution and its impacts on human health has just not been appreciated. And then lastly, of course, the big elephant in the room here, the big barrier to the control of pollution, are people, not naming any well-known brothers, who have a vested interest in keeping pollution going, because it's good for them. It may not be good for anybody else, but it's good for them, and they have lots of money and lots of political power. And it's not just in this country, it's in countries around the world. And those sorts of people are able to stymie regulation. And if you don't believe me, go to Scott Phillip's website. So, as always, there are some limitations in the analysis. We didn't have complete data in many countries. In fact, in more than half of countries on pollution levels and disease prevalence, and so we have to do knowledgeable guesses. We lack information about lots of the chemicals. We know very little about what are the long-term, decades later, consequences of exposures in early life, and some pollutants and some categories of exposure simply are not yet included in the counts. We concluded with a series of recommendations, and number one, pollution prevention has to be a high priority. It has to be integrally included in the development agenda for countries. It has to be included in the non-communicable disease control program, and it needs money. You need the attention, you need the money, you need data, which is this one, political leadership, and it has to be global, and the UN agencies have to get together behind this. Fortunately, we've got the UN Environment Agency has come on board. The UN Environment Assembly will be taking place in December of this year in Nairobi. And the theme is towards a pollution-free world. And basically, we worked with them, we shaped that agenda, and all of a sudden pollution is moving to center stage. Let's see if it sticks. And of course, a whole series of research recommendations, better research on new pollutants, old pollutants, better maps, better estimates of the economics of it all. So what are the next steps? The next steps are, we're in the process of building what we're calling a global pollution observatory, which will track pollution in countries around the world. There already exists a global climate change thing based in London, which is supported by the Lancet, our publisher. And we're going to model what we're doing on the climate change initiative. And in fact, I spent about an hour on the phone this afternoon with people at the Institute for Health Metrics in Seattle. We're going to see if we can make them partners in this enterprise. We're working with my colleague Richard Fuller, and I, more Richard than I, because he loves to travel. He's going to cities and countries around the world, sitting down with health ministers, environment ministers, and finance ministers. He refuses to have the meeting if he doesn't get all three ministers in the room together, and helping them to develop health and pollution control plans. And we've got a website, of course, where you can tell your pollution story. Let me wrap this up, since it's 8 o'clock, by giving you a positive story to send you home happy after all this, after all this doom and gloom. And tell you that based on the American experience, that we have been very successful in this country when the political stars line up in translating science into policy that saves people's lives. And I've already foreshadowed this example by mentioning lead. So most of the students in the room won't know this because, or at least they won't remember it because you weren't yet born. But from 1922 until 1976, lead was added to gasoline in this country and in countries around the world to improve engine performance, to boost octane of the gasoline. And the evidence began to build in the late 60s and accelerating into the 70s, showing that even low levels of lead that were widely prevalent in American children at that time, were causing brain damage, loss of IQ, shortening of attention span, disrupted behavior. There were vicious fights. I was at EPA down in North Carolina with lead industry people on one side of the table and the pediatricians on the other side of the table arguing the science. The lead industry saying that the science was not believable. I didn't call it fake news because the term hadn't yet been invented, but that's what they were saying. And we were laying out the facts. Finally, in an act of great courage, the administrator of EPA at that time made the decision to take lead out of gasoline. At that time, we were putting, you can see from the vertical axis on the left-hand side, we were putting about 100,000 tons of lead into gasoline in the U.S. each year. And that was just in the U.S. Countries around the world were doing the same thing. And the average blood level of American children at that time was in the neighborhood of 20 micrograms per deciliter, which is a level that today would send a pediatrician in the emergency room running for the hotline to call the health department to get out to the child's house to see where the lead was coming from. But back then, it was the norm. In fact, the CDC standard for lead in blood was 40 micrograms because no child seized, developed convulsions below that level. So the average was about 20. And we started taking lead out of gasoline, and over the next 5 years, the amount of lead put in came down by more than 50%. It was predicted that blood lead levels would fall a bit, the white line, but in fact they plummeted from an average of about 17, 18, down to 9, and in subsequent years they've continued to come down, and today the average is about 1.5 or something micrograms. So what are the consequences of all that? The consequences are the obvious, the 95% reduction in blood lead levels, the reduction in lead poisoning, but this is even better. 2 to 5 point gain in the average IQ of the American population. And when you get a 5 point gain in the average IQ of a whole population, it means you're doubling the number of children in the population with an IQ of above 130 and reducing by 50% the number of kids with an IQ below 70. So this really lifts the boat. The reason my grandkids are much smarter than I am is because they grew up in an environment largely free of lead. And then here's the economic gain. Joel Schwartz, who's over at Harvard, has calculated that this increased intelligence and the increased economic productivity that follows from it has given $200 billion back to the economy every year since 1980, when we mostly get rid of lead and gasoline, which multiplies out to a cumulative benefit of $6 trillion since 1981. Smart public health action. Ministers of finance like this kind of data. Thank you.
So my name is Jim Keenan, and we have about 10-15 minutes for questions. Amy's there, Mr. there with a microphone. Amy, here's Shay is right there. Amy? Shay has her hand up. No? Angela? Yeah, that's Shay.
Hi. You spoke a little bit about gasoline and coal. My question regards natural gas. Like fracking use. Is there any research that you're familiar with or involved in regarding fracking and the waste products from fracking? Water contamination?
Yeah, so fracking has some obvious benefits. It produces a great amount of gas. It's changed the United States from a net importer to a net exporter of energy. That may reduce the temptation to become involved in future wars in the Middle East over oil. That's the good side of fracking. The bad news on fracking is that it's an ecological disaster. That it contaminates groundwater. It releases a whole slew of toxic vapors in the vicinity of the gas wells, everything from methane to benzene to the vapors of volatile organic solvents that are used in great quantities in the wells. Another problem is that many of these wells, as you know, are located in rural areas, and it takes tens of thousands of tanker trucks running back and forth through these rural communities day and night in places like Pennsylvania, West Virginia, carrying water and chemicals in to service the wells, so that the destruction of the economy in these towns is profound. That's sort of the micro critique of fracking. The macro critique involves the notion that natural gas is what's called a transitional fuel. Which is to say, it's better than coal, it's better than oil. It reduces a lot less CO2 and other greenhouse gases from combustion than coal and oil do. But it still forces us to be dependent upon fossil fuels. Gas is still a fossil fuel, right? And the ultimate solution, of course, is to get beyond gas and skip over it and go to wind and solar.
Andrea?
Thank you very much for your very important talk. I was thinking that in terms of proposals for action, what you presented, it seems to me, was a top-down approach. So we need to intervene, we need to, let's say, the example, lead, remove lead from the gasoline. What do you think about a bottom-up approach? So citizens, what communities can do, what organizational consumers can do to follow this movement toward addressing pollution and reducing and hopefully eliminating it in the next 10 years.
Yeah.
So do you see a role for citizenship, for action from the grassroots?
Yes, I think the two are complementary to each other. I think the best example I can give you of the power of the grassroots to control pollution is the story of air monitoring in Beijing. So initially, there was just one air monitor in Beijing. That was the one on top of the US Embassy, which started releasing results in the United States, which of course in the electronic age got sent right back to China and initially dismissed, ignored, buried by the relevant ministries. But then a few local people in China began to get their hands on air monitors, which are quite portable these days, and began putting data out on the internet. Pretty soon, internet communities formed in Beijing, daily publishing air pollution results in different parts of the cities. Of the city, bright kids created maps out of this so that people could see what were the pollution levels in their own neighborhoods, which are never the same, of course, between neighborhoods. And the power of this grassroots thing basically was one of the big drivers of the Chinese government decision to move in a big way into renewables. Yeah.
In the back.
I was just wondering about your thoughts on the possible impact of the EPA's current trend towards reversing some of the prior administration's rules and regulations that dealt with pollution and climate change, and also, with the talk about bringing back coal mines and such. What would be the impact of, those regulations over, say, the next 4 or 8 years?
So EPA, in the current administration, in the Trump administration, is in various stages of rolling back at least 400 environmental health and safety regulations. Everybody knows about the big ones, such as withdrawing from the Paris Climate Accord, which they haven't quite yet done, but they're on the brink of doing. A very disastrous one just this week was erasing the so-called Clean Power Plan, which will bring back coal. The American Academy of Pediatrics, my professional organization, has joined with the American Medical Association, the American Lung Association, and 9 or 10 other, American Public Health Association, and 9 or 10 other major health organizations to strongly criticize that decision. And we've done calculations figuring that hundreds of unnecessary deaths and thousands of cases of unnecessary illness are going to result each year in the United States if these decisions stand. Up until now, at least, the courts have provided some degree of protection against these disastrous decisions. But if the Trump administration is in power for a long period of time, with each passing year, they'll have the opportunity to appoint more judges to the federal bench. And if that trend continues for a few years, they may be able to bring about a lot of these changes with very little interference. I think ultimately it speaks to the importance of everybody getting out and voting.
Could I follow that up?
Yeah.
Maybe it takes Andrea's question. because that again is a top-down approach. How would you present this argument on Fox News? I mean, this is very nice at BC, but this is in Fox News. What type of rhetoric do you use to say something where the majority of those people who are viewers of Fox News are complacent with the issues that you're raising?
Yeah, that's right. It's so important. I mean, it's so important to communicate outside your own club.
Right.
Absolutely. So I think there's multiple ways to reach across the political aisle. One strategy that I've used throughout my professional life, I hate to say use, but I've employed it anyway, is to talk about the impact of environmental pollution on the health of children. Because everybody has kids, Republicans, Democrats, Independents, any religion. We all have children. We all have grandchildren. And nobody is safe from polluted air. You might be able to protect yourself against water by drinking bottled water. You can choose not to live near a landfill, but we all have to breathe the air. It's a common resource. And the data are abundantly clear that polluted air causes disease and death in children, as well as in the rest of the population. Another strategy for reaching across the political aisle is to reach out to our brothers and sisters in the faith community, Catholics, evangelicals, Jews, and get people talking from the pulpit about protecting the planet. There's a group called the Environmental Evangelical Network based in Washington, D.C. I've worked with them for years. They're mostly Baptist and Methodist preachers, mostly from across the southern states. And they are very powerful, and they reach a constituency who are almost all not Democrats. And it's important also, this gets back to what Andrea said, to do all kinds of work at the local level. Look at the, what's the name of the group that you're on?
Indivisible.
The indivisible people who are pushing back on so many fronts around the country, and pollution has to be one of them. And finally, split the opposition. And the opposition is not monolithic. Different people have different interests. That's how we got lead out of gasoline, because the automakers realized that the lead in the gasoline was destroying their engines, and all of a sudden the automakers parted company with the lead manufacturers. We need to be smart. We have to look for ways to split the opposition here. There's no single silver bullet. Oh, and of course the states. The states are so important. Think of what's going on in California right now.
One more, Luke.
Hello, thank you very much for coming to speak to us. I was really fascinated when you talked about how pollution is a solvable issue because it results from like human behavior, and if that behavior is changed, it can be solved. So I was just kind of curious about what suggestions or things have been put in place for the populations who depend, like, to support themselves and their families on things like those battery, the lead battery yards and the gold mining. Has anything from your commission or come out of your commission to like address the needs of those populations?
Yeah. I think the short answer is not enough is being done, but what is happening in some places is that groups around the world, many of them NGOs, non-governmental organizations, and sometimes with government funding as well, are working in those communities to find ways to provide either alternative methods of recovering the lead or the gold, or whole different ways of making a living altogether. It's slow, horrible, patient work in the world's worst places, but it can be done. If you visit the website of Pure Earth, which is the not-for-profit that was established some 20 years ago by my partner, Richard Flynn, the co-chair of this commission, they've been going out to some of the world's most polluted places now for a couple of decades, working with local communities, trying to clean up these situations. And in fact, the genesis of the idea to form this commission was Richard's realization that he would need 10 more lifetimes to clean up these places one at a time, that we needed to raise the whole issue of pollution to a higher level of visibility.
So I'd like to warmly thank Phil for this presentation, for this engagement, but in a particular way for his entire leadership. in the question of the impact of pollution on our health systems, but above all on our children. Thank you, Philip.